So good day, everyone. I am Dr. Pritimoy from Federation University, Australia. I am honored to speak on the theme of International Youth Day, local youth actions for the SDGs and beyond. In celebration of the United Nations International Youth Day 2025, with World Association for Sustainable Development and its partners across the world, today I am presenting local youth actions for reduced inequalities, addressing mental health disparities among Bangladeshi migrants in Australia, which directly aligns with this crucial theme. The theme of 2025 International Youth Day is deeply aligned with the World Programme of Action for Youth, which sets a policy framework and practical guidelines for national actions and international support to improve the situations of young people. This year's objective for International Youth Day are to recognize youth as key local development partner, policy adaptation, and collaboration. This shared vision and focus on local action directly connects to a crucial challenge we investigated, the significant mental health disparities faced by young migrants. Back in 1946, the World Health Organization defined health in its first constitution as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. However, over the past half century, mental health has not received the international attention, political priority, or funding that it deserves. In Australia, it is estimated over one in 5 people experienced a mental health disorder in the previous 12 months. Among the leading diseases in Australia, mental health issues ranked just after the coronary heart diseases and musculoskeletal problems. One unique feature of Australia is that it is a multicultural country with 30% of the Australian population are overseas born, and hence they are called migrants. Bangladesh is a small country in South Asia. The number of Bangladeshi migrants in Australia has been increasing rapidly in recent years. Despite the large number of Bangladeshi migrants living in Australia, there is limited information on common mental health issues among them. The lack of understanding makes it difficult to address the roots of distress within this population. To truly understand these challenges, we need to unpack the roots of this distress, starting with the prevalence and the key risk factors investigated. In 2023, we enrolled 196 Bangladeshi migrants from all over the Australian states and territories. Their mean age was 40 years, male represented slightly higher than female. Most of the participants were from Victoria and New South Wales, where 80% of Bangladeshi migrants reside. The prevalence of high to very high psychological distress among Bangladeshi migrants in Australia was 43%. The prevalence of depression among them was 35%. To put this into perspective, this prevalence of psychological distress and depression was at least 3 times higher than the Australian national average. This significant disparity underscores an urgent need to reduce the inequalities within countries, ensuring mental health well-being for all population, including migrants' youth. The risk factors were at least double among migrants with multiple comorbidities and who experienced discrimination and racism in Australia. Loneliness, dissatisfaction with friendship, a lack of community engagement, and low English proficiency were other risk factors. Beyond these statistics, it is crucial to hear the authentic voices and lived experiences from the community, which reveal the profound human dimension of these inequalities. Our qualitative research captured the lived experience of Bangladeshi migrants, revealing profound insights into their struggles. There are clear gaps in public health communications too. As one of our migrant respondents described, in Australia, you will never see anything on local channel that says, okay, this is the mental health service available for migrants. Despite these immense challenges, we also found incredible resilience and existing coping mechanisms within the Bangladeshi migrant community, which offer valuable pathways for localized interventions. These include informal coping strategies such as relying on family and friends, support, and engaging in religious practices. We also observed innovative self-help methods like using affordable online counseling sessions from Bangladesh and smartphone apps, which indicated willingness to seek support if accessible and culturally appropriate. These existing coping mechanisms offer valuable insights for developing culturally relevant formal support service and multi-stakeholders collaborations. It is now well known that over 65% of SDG targets directly relate to local governments, and empowered young people are catalysts for innovation and resilience in the communities. Our research directly supports the International Youth Day objectives, especially SDG 10, reduced inequalities, by focusing on local mental health challenges faced by young migrants. It provides actionable recommendations for local governments, community organizations, and healthcare providers to empower migrant youth. For example, youth-led community groups can create safe spaces for dialogue on mental health, leveraging their unique insights into local needs. This vital work concludes with a clear call to action for International Youth Day, outlining our shared responsibility to empower migrant youth. Governments must integrate youth perspectives into policy formulation and local planning process, and invest in youth capacity building and infrastructure. International organizations and civil society are encouraged to support youth-led and youth-serving initiatives at the local level and foster enabling environments that uphold youth rights. In addition, academia should continue to conduct rigorous research to inform evidence-based, culturally responsive interventions for diverse youth population. By working together on these, we will achieve equitable mental health and well-being for all young people, ensuring no one is left behind in our pursuit of the SDGs. Thank you for your time and attention today. Please feel free to connect with me if you have further questions or would like to collaborate.